AM560theanswer.com. Now, from the Signature Bank Studios. If you're looking for the latest news, insight into what it means, and the sharpest opinion, there's only one station in Chicago where you can turn, and it's this one. We're AM560, The Answer.
Top of the morning, Dan Proft here. President Trump, with the press gaggle on Air Force One, was asked about the extension of Obamacare subsidies to that cohort that got a 2-year deal under the Biden administration, like $120,000 up to $500,000 in household income. Set to expire at the end of this month. This was the basis, the Dem Socialists said, for their shutdown. So Trump says he's in conversations with the other side. However, he is disinclined to extend those subsidies. Take a listen.
We're looking at different alternatives. I mean, I like my plan the best. Don't give any money to the insurance companies. Give it to the people directly. Let them go out and buy their own health care plan. And we're looking at that. If that can work, we're looking at that. That's sort of take it off. That's what I like. Don't give the money to the insurance companies. They go out and buy their own plan. You give the money to the people. I like it the best.
Are you planning to extend those subsidies?
I'd rather not. Somebody said I want to extend them for 2 years. I don't want to extend them for 2 years. I'd rather not extend them at all. And maybe some kind of an extension may be necessary to get something else done. Because the Unaffordable Care Act has been a disaster. It's a disaster. And I said it was when it first got put in. Unfortunately, we lost a couple of Republican votes, and the Democrats voted for it. It's a Democrat plan. And the premiums are going up, and it's the Democrats' fault. But, you know, they are negotiating with me. It's very interesting. They want to see something happen.
Who are you talking to on the Democrats' side?
I can't tell you, but we have a lot of Democrats want this plan to happen. They would love to see the money go to the people, and the people go out and get their own health care. And there would be nothing like it.
That sounds good, but maybe there's a better approach, even short term. Michael Cannon from the Cato Institute, in an op-ed, is concerned about a woodwork effect. The woodwork effect means when a government program extends eligibility and benefits, people come out of the woodwork to sign up. And he writes, taking money from taxpayers only to give it back with strings attached isn't the way to empower consumers. That woodwork effect could actually increase Obamacare spending. Fortunately, though, he argues, Trump already demonstrated in his first term how to make coverage affordable for millions without destabilizing Obamacare or costing taxpayers a dime. Exempting from Obamacare, which the Unaffordable Act, as he calls it, appropriately, exempting from Obamacare was short-term limited duration insurance. That exemption shields those plans from Obamacare regulations that cause premiums to double for healthy enrollees that ration care for the sick. In 2018, Trump removed those restrictions and freed those plans to offer greater protection. He clarified that federal law allows short-term plans to last 36 months and to offer renewal guarantees. Renewal guarantees give patients who develop expensive illnesses the perpetual right to re-enroll in their health plans at healthy person premiums. This approach that Trump took in his first term was upheld by the courts. So that's the direction he might consider taking. Meanwhile, this was great. If you didn't see this, you should see it just because Betsy Quick over at CNBC was so properly disgusted and dismissive with the hackery of Hakeem Jeffries, who is just really bad at his job, and I don't think he has any idea what he's talking about when it comes to healthcare and so many other topics. This was their exchange about the Obamacare subsidies and said extension.
To satiate, if you want to get done, you are going to need at least some Republicans to come over. Why not start with a 1-year extension or potentially even a 2-year extension?
Well, Leader Schumer offered a 1-year extension in the context of trying to end the Trump Republican shutdown.
Yeah, but that's different. I'm talking about what you have now. Let's not go back to what's done in the past and what has not been extended. If you want to get something that has actually done, you need to do something that will have bipartisanship.
You can ask me the question. You can ask me the question. I'll provide the answer.
Answer the question instead of going back.
I'll provide the answer. No. I'm providing an answer in order to provide context. Republicans have repeatedly refused to take yes for an answer. It was a very reasonable multi-year extension that was offered. It was a 1-year straight extension plus a multi-year process through a bipartisan commission to more permanently resolve the Affordable Care Act issue. So having that context is absolutely important, regardless of what you may think.
It's important context to make me realize that I don't think you want to get a deal done. I think this is something where you'd like to see the rates go higher and allow the Republicans to hang themselves with that. Is that the answer?
That's absolutely a ridiculous assertion. And really, shame
3 years
on you.
Is not going to get passed, so what do you do?
Shame on you.
Yeah, shame on her. Yeah, right. I mean, I don't agree with Betsy Quick. And I agree with Trump. I'm disinclined to extend the subsidies, but Hakeem Jeffries, she had him sussed out pretty good on that. On the politics he's playing, that piece of it. Stephen Moore is an economist. He's the author of The Trump Economic Miracle and the Plan to Unleash Prosperity Again, co-authored with Art Laffer. He joins us now. Stephen, thanks for joining us.
Well, happy Thanksgiving. How are you doing?
Same to you. So Obamacare subsidies, Trump is disinclined. What do you think about his approach, and maybe a better approach is what Michael Cannon argues for those short-term policies?
Well, a couple of observations. One is, we were the ones who first came up with we were the ones who started calling it the Unaffordable Care Act a few months ago. I'm glad to see Trump has picked up on that. It is the Unaffordable Care Act. I mean, it's so interesting, Dan. If that was passed in 2010, so we've had 15 years of experience with the Affordable Care Act, and over that time, overall health care costs have in most states doubled, almost all states doubled, and many states tripled. So, that doesn't sound like it's made healthcare very affordable. And it's people are, I don't know about you, Dan, but we just got our statement on our premiums next year. They're going up 12%. And some people are seeing 15 to 20% premium increases. It's getting outrageous how much healthcare costs. Now, let's start with this. Let's make this crystal clear. Okay, Dan, I'm going to make it really simple. You and I probably couldn't devise a stupider way to pay for health care than the way we do it in America. It is so stupid. We could probably get better health care outcomes at half the cost if we just used the free market system and got the government the hell out of the picture. And we could just subsidize people, low-income people to get care. But we've created this government-run monster that, by the way, the people who are getting rich off of this are the insurance companies. Did you know, Dan, the biggest supporters of extending all these Obamacare subsidies were the insurance companies?
Well, they wrote Obamacare, so you would think they'd want to continue to prop it up.
They want more of it. So it is all you need to do. I mean, let's keep this very simple because we made it too complicated. Why do you have fire insurance on your home, folks? Hopefully, almost all of you do, because if a very, very rare event happens that your house burns down, you have insurance for it. You have insurance for rare kind of occurrences that could wipe you out, and that's why we have insurance on your house. But you don't have insurance for taking your car in for an oil change, do you? I hope not.
No.
So in other words, my point is what we should have in this country is basically people pay for their health care out of pocket. You have a competitive market. This would drive costs down. You say, gee, if I go to this doctor, he's going to pay me $600. He's going to charge me $600. This doctor is only going to charge me $400. Or, this drug costs me $800. This one costs me $400. Or this, you have places in Washington, D.C. where you go to one hospital and they'll charge, say, $800 for an MRI, and the next one will be charging $1,800 for an MRI. But we don't shop around. So my point is, let's move to something really simple where people just pay out of pocket up to a certain amount, and then you have insurance for that. And then you'd have competition, you'd have price transparency, and you'd bring down costs, and you would get a better quality of care. We have nothing like that. We have first dollar coverage for most people. So when's the last time, Dan, you can tell I feel passionately about this. When's the last time you went to a doctor or a hospital or even got a drug for some kind of sickness, and you asked how much it costs?
Right. I understand. I mean, this is what your buddy Steve Forbes has been saying for decades, right?
I know, and he's exactly right. I mean, it's just ridiculous. And so everybody's scamming the system, and the costs go up and up and up. And what do the Democrats want ultimately? They want what's called a single-payer system where the government just pays for all the health care. Gee, that's gonna really turn out well.
So what's your intuition on what happens between now and the end of the year on this?
I think we are going to have a shutdown again.
You do?
Because Democrats, yeah, I do. And I hope I'm wrong about this, but the Democrats seem pretty, from my friends over at the White House, they say the Democrats don't seem to be in the frame of mind of even compromising on this. You heard that conversation between Betsy Quick and Hakeem Jeffries. Did he sound like he wants to make a deal?
No. Especially not if Trump doesn't want to extend Obamacare subsidies for that small cohort at all.
Did you say, by the way, that the number 700% of the poverty level? You're going to have people making $250,000 getting health care subsidies from taxpayers
or more.
Yeah, it's crazy. So I think Trump is on the right track. We have to move towards high deductible plans with catastrophic insurance. By the way, the other stupid thing that the government has done, did you know that the quote Affordable Care Act makes, if you and I wanted, and your listeners wanted to just go out and say, look, I want to just opt out. I just want a catastrophic coverage plan that just covers me, for if I have a major event, like I get a bout of cancer or I have a chronic disease or I have a bad injury. You can't buy, it's illegal. It's illegal to buy that kind of plan.
Yeah, well, that's what Obamacare was, as we've been saying for the better part of the last 15 years, was a backdoor takeover of health insurance. You've got a state sanctioned oligopoly with these insurance companies. So I mean, he's right to go after the insurance companies, but it needs sort of a larger description of what has occurred and the path forward. Even and frankly, if it has to come in stages, like I know I can't get the whole loaf right away, but I want at least this much of the loaf, and then we can go from here to there to there.
You've got to admit that the liberals are very devious, and they're very, they've been very successful. So, you and I talked about this 15 years ago, that they wanted to jump over the whole river at once and end up with a single-payer system. And by the way, I have to say that the one guy who was honest about that was Bernie Sanders. He said, let's just have the government run the healthcare system. And then they said, well, no, we can't do this. So what they did is they put a stone in the middle of the river, and that was called Obamacare, and they jumped on that stone. And then the next leap is to get to a single-payer system. And so that's where we're at. We're paying way, way too much. The people are going to be so furious when they see their bills for healthcare next year, and it's in the bill is in the mail, folks. You're going to be paying 15 or 20% more next year for healthcare. It is going to bankrupt this country if we keep. And by the way, over the last 15 years, there's no evidence that all of this additional spending that we've done, Dan, on healthcare has actually improved health outcomes. In fact,
it's like talking about government K through 12 school systems.
Exactly, it's exactly like that. And so, here's an amazing statistic that if you compare people who don't have any insurance at all with people on Medicaid, there's no difference in their health outcomes.
Let's expand.
Where's all this money going? Seriously, we started spending $1 trillion a year at the federal level on healthcare. Where is all the money going? It's going to it's just a racket. I mean, I'm so angry about it.
To the insurance companies and the PBMs, which the insurance companies own. That was a topic of conversation this week on the Hill. Let's expand the affordability question. I want to offer this commentary on affordability. I thought I was reading Stephen Moore, but it turns out I wasn't. Take a listen here. If America has an affordability crisis, it tends to be in places Democrats govern, like New York, Illinois, and California, which all feature high taxes, soaring housing costs, and stagnant outcomes in basic areas like education and infrastructure. That's Fareed Zakaria channeling Steve Moore. How about that?
He did. He was channeling us. I had made it almost exactly that same point in our hotline in the Wall Street Journal about a week before, and sure enough, it was almost like he was reading from our article. But by the way, good for Fareed. He's much more liberal, but he's calling balls and strikes, the right way. to put it very simply, if you live in a blue state, you're paying about 30 to 40% more for everything that the government provides. And if you, by the way, we just updated that study that we're putting out in this morning hotline, and then we looked at, well, which cities have the highest costs? Well, what do you think the 5 highest cost cities are?
San Francisco.
Yes.
New York.
Yes.
L.A.
Yes.
Chicago.
Yes. Right.
Am I missing one? Yeah.
San Diego is one other one. In other words, any city in a blue state, big city, has huge high costs. And in fact, you're paying, a huge premium because, they have high taxes, high regulation. They're the cities. Why is it so expensive to get an apartment in places like Chicago or New York or Washington, D.C.? Because they have rent control, because they have zoning restrictions that make it illegal to build new housing. Gee, if you make it illegal to build new housing, don't you think rents are going to be a little higher?
Mm-hmm. Yeah, there's that whole supply and demand thing I've heard so much about.
Hate that, yeah.
I want something that Victor Davis Hanson said the other day on Laura Ingram's show. I wanted to get your reaction to, and if you think that VDH's position represents the general attitude of the Republican Party on the Hill. I mean, he is very optimistic about next year for Trump and, by extension, the midterms. Take a listen.
They said that for 3 months, 4 months, 5 months after January 6th. He was all through. He was all washed up. And then they didn't even have a serious primary. No one even got near him. And the main candidates withdrew very quickly. It's the same thing. And they can't decide whether they want to run against Trump or that he's not going to be there. But whatever it is, he dominates the party. He's like a colossus that just strides over the party and the country. And they know that. And they've tried everything, Laura. They've tried to raid his house. They've deballoted him. They had 5 lawfare cases, 91 charges, indictments. And he's kind of anything that doesn't destroy him makes him stronger. And so he's going to have a booming economy next spring when all this foreign investment, this more energy development, more tax reduction, deregulation. It's going to be a good year. And I think everybody knows it. And I think the left, they're reduced to nothing, and they're cutting these videos that are calling for military insubordination, and it's violating a lot of the elements of the Uniform Code of Military Justice, Article 88, Article 90, Article 92, and they're so desperate, but there's no defection. I think he's stronger than he ever was.
What do you think, Steve?
Well, I totally agree, and I've been saying this, and Larry Kudlow has been saying it, Steve Forbes has been saying it. We're going to have a really strong economy in 2026. I think we could have above 4% growth, which we haven't seen in a long time. By the way, when you have 4% growth, you create a lot of tax revenues, and that brings the debt down. And, but people forget that, people come up to me all the time. Well, I didn't feel any effect from that Trump, big beautiful bill. I said, well, you haven't, because it doesn't really take effect for most people until next year. And what's going to happen is that when the withholding, on your paycheck is reflective of the new tax cut, the average family is going to see about $1,500 to $2,000 more in their paychecks over the next year, just because of the big beautiful bill. So then the idea of, by the way, it's not Trump has $20 trillion of. Donald Trump, I love the guy, but he does exaggerate a little bit, Dan. Did you know that? He exaggerates. Mm-hmm. Yes. So it's not $20 trillion, but let's say he's wrong by 90%. That's still $2 trillion.
Government rounding error. Yeah, of course.
Exactly. So that's a whole lot of money that brings in jobs and brings in new investments. So, yeah, you can count me in the super bullish. Now, whether that means that the Republicans will win the midterms, I doubt it. I'll be honest with you. I think the Democrats are energized right now. You saw that in the 2020, the elections earlier this month. So, yeah, I'd be nervous if I were Republicans about, holding on to the House. And even the Senate, I think, is in play. But in terms of the economy, I can tell you it's going to be really good next year.
Stephen Moore, economist, author of The Trump Economic Miracle and The Plan to Unleash Prosperity Again, co-authored with Art Laffer. Steve, thanks as always. Happy Thanksgiving.
Okay, Dan, you too. Take care.
Take care. And Steve joined us on the Turnkey.pro answer line.
The stories you need to know to start your day. This is Chicago's Morning Answer on AM 560. The Answer.
At AlmostFreeTeeth.com, they're dedicated to making smiles great again. If you have medical PPO insurance, find out how you could save 90% off on average to get a beautiful dental implant-supported smile. Check if you qualify right now at